Thank you guys for having me. Again, my name is Dr. Rupal Upadhyay. I'm a pediatrician here in the Elgin area. This is an excellent question because for a lot of patients, they don't always know where to start when seeking help for development. As a pediatrician, it is our job to assess all of our children starting as early as newborns, not just for developmental milestones, but obviously physical growth. So that's a big part of what we do every day when we meet our babies for the very first time. There are specific tools that are available that we also utilize, and in fact, the American Academy of Pediatrics recommends specific tools for pediatricians to use, and many of you are probably familiar as parents because you have filled out these forms. They're called Ages and Stages Questionnaire, or ASQ, and it's basically a developmental screening that we offer starting as early as 6 months of age. And then we do it about 6 times throughout the year between 6 months to 5 years of age, in addition to the normal developmental milestones that we would look for at every well visit. These are specific ones that are done at 6 months, 12 months, 18 months, 2 years, 2.5 years, and then again at the 5-year checkup. We have additional ones that we can always offer to patients if we have any concerns. Now these again are sort of just a guide to give us an idea as to whether or not a patient is developing appropriately. We always want input from parents if there is something more specific that they might be concerned about as well. And as a pediatrician, it's also equally important, our role, in reassuring parents that sometimes not every child follows the exact same trajectory of development. There can be very normal variations. So for example, one child may start to babble as early as 4 to 6 months of age. Another child may not reach that milestone for another 3 to 6 months later, and that can still be well within a normal range. So it's our job, of course, to make sure that we do get patients who need early intervention engaged in those programs if necessary, but also to continue to monitor progress. And because we see most of our babies at least every 2 or 3 months, we have the ability to kind of gauge how that progress is going before we decide if intervention is necessary.
Thank you so much. And we're going to move on to the next question. Just